I'll never forget the email I got from a student last year. She had just failed the NCLEX for the third time, and she was devastated. And she wrote, I don't understand. I studied 8 hours a day for 2 months. I did thousands of practice questions. I know the content. I can tell you everything about heart failure, sepsis, diabetes. But when I sit down for the exam, my mind goes blank. I freeze, and I pick the wrong answer every single time.
That's the paradox that breaks students. The harder they study, the worse they perform. More hours, more content, more practice questions, and still they fail.
And here's what I told her. You're not failing because you don't know enough. You're failing because you're trying to memorize your way through a reasoning exam.
And that's a fundamentally different problem that requires a fundamentally different solution.
See, this student could recite facts. She could tell you the signs and symptoms of heart failure. She could list the medications. She could describe the pathophysiology. But when the exam gave her a question like this, a patient with heart failure presents with worsening shortness of breath, crackles in the lungs, and 2+ pitting edema. Blood pressure is 168/92. Which intervention should the nurse prioritize? She froze because the question wasn't asking her to recite facts. It was asking her to reason. And memorization doesn't teach you how to reason.
It's why students can ace their med-surg exams, which test recall, and then bomb the NCLEX, which tests clinical judgment. Two completely different cognitive skills.
And here's the really brutal part. The more facts you try to cram into your brain, the worse you get at reasoning, because your brain has a limited amount of working memory. And when you fill it with thousands of isolated facts, there's no room left for thinking.
So students walk into high-pressure situations, exams, clinicals, codes, with a brain full of information they can't access when they actually need it.
And that's what this episode is about. Why memorization fails you under pressure, how your brain actually works when you're stressed, and what to do instead. Welcome to the Think Like a Provider podcast. I'm Jenna Way, nurse practitioner and educator. Here, we don't memorize, we understand. Each episode, we break down clinical reasoning system by system, so you walk away thinking and acting like the provider you are meant to be.
And I'm Alice, and I'm here to bridge concepts and connect the dots you might be missing.
So let's talk about what actually happens in your brain when you're under pressure. Because once you understand the neuroscience, you'll understand why memorization is setting you up to fail.
And more importantly, what actually works instead.
The problem, your brain under pressure. Here's what most students don't understand about how the brain works. You have two types of memory, working memory and long-term memory. Working memory is like RAM on a computer. It's the space where you actively think, where you process information, where you solve problems. And it's tiny. Research shows the average person can hold about 4 to 7 pieces of information in working memory at one time.
So when you're taking an exam or standing at a patient's bedside trying to figure out what to do next, you have maybe 5 slots of active thinking space. That's it.
That's it. And here's the problem. If those 5 slots are filled with trying to remember facts, you have no room left to actually think. Let me give you an example. You're taking the NCLEX. You get a question about a patient with hyperkalemia. If you're thinking like a student, here's what's happening in your working memory. Slot 1. What's the normal potassium range? 3.5 to 5.0. Slot 2. What are the signs of hyperkalemia? Muscle weakness, cardiac arrhythmias. Slot 3. What medications lower potassium? Kayexalate. Insulin with D50. Slot 4. Wait, what was the patient's potassium level in the question? Let me reread. Slot 5. Okay, 6.2. Is that high? Yes. So I need to lower it. Which answer lowers potassium?
And now you're out of working memory space. You're so busy trying to recall facts that you're not actually reasoning through the clinical scenario. You're pattern matching instead of thinking.
Exactly. And pattern matching works great, until the question is even slightly different from what you memorized. Now, let me show you what happens when you think like a provider. Same question, patient with hyperkalemia. Here's what's in working memory. Slot 1, hyperkalemia affects the heart. That's the danger. Slot 2, patient has peaked T waves. Heart is already being affected. Slot 3. Priority is cardiac stabilization, not lowering potassium yet. Slot 4. Calcium gluconate stabilizes cardiac membrane. That's the answer.
4 slots instead of 5. And more importantly, you're reasoning through the priority instead of trying to remember a list. That's why providers can think faster and more accurately under pressure.
Because they're not wasting cognitive resources on recall. They're using their working memory for what it's designed for, reasoning. And here's where it gets worse for students who rely on memorization. When you're under stress, exam pressure, clinical emergency, time crunch, your working memory shrinks even more.
This is the fight or flight response. Cortisol floods your brain, your prefrontal cortex goes offline, and suddenly those 5 slots of working memory drop to maybe 2 or 3, which is why students who know the content suddenly can't access it when they're panicking during an exam.
Exactly. Your brain literally cannot hold all those facts when you're stressed. So if your strategy is memorize more, you're fighting against your own neurobiology. The shift from memorization to understanding. So here's the shift you need to make. Stop trying to memorize isolated facts. Start building mental models.
Okay, break that down. What's a mental model?
A mental model is a framework for how something works. Let me give you an example. Memorization approach to heart failure. Signs: shortness of breath, crackles, edema, fatigue, weight gain. Causes: MI, hypertension, valve disease, cardiomyopathy. Medications: ACE inhibitors, beta blockers, diuretics, and digoxin. Nursing interventions: monitor I and O, daily weights, restrict sodium and fluids.
That's a list. You can memorize it, sure. But when a question asks you to prioritize between 3 interventions that all seem correct, the list doesn't help you choose.
Exactly, because the list doesn't teach you how heart failure actually works. Now here's the mental model approach. Heart failure means the heart can't pump effectively. So what happens? Blood backs up, fluid accumulates, organs don't get enough perfusion. Where does fluid accumulate? In the lungs, pulmonary edema, and the periphery, peripheral edema. What does the body try to do? It compensates. It retains fluid to increase preload. It increases heart rate to maintain cardiac output. It constricts blood vessels to maintain blood pressure. What's the danger? Fluid overload causes respiratory failure. Poor perfusion causes organ damage. What's the priority? Get the fluid off, diuretics. Reduce the workload on the heart, ACE inhibitors, beta blockers. Monitor the decompensation, I and O, daily weights, breath sounds.
So instead of memorizing a list, you understand the mechanism. And once you understand the mechanism, you can reason through any question about heart failure, even if it's asking something you've never seen before.
Exactly. That's the difference between memorization and understanding. Memorization is fragile. If the question is slightly different from what you studied, you're lost. Understanding is flexible. You can apply it to any scenario because you know how the system works.
And this is why students who study harder don't always do better. They're adding more facts to memorize instead of building deeper understanding of the mechanisms.
Exactly. And the mental model approach actually takes up less working memory because instead of remembering 15 isolated facts about heart failure, you remember one framework. The heart can't pump implies fluid backs up, implies organs suffer. And from that framework, you can derive everything else. Why practice questions aren't enough. Now here's where students get stuck. They think doing thousands of practice questions will fix this problem. And practice questions are helpful, but not the way most students use them.
Right. Most students do practice questions like this. Read the question, pick an answer, check if they got it right. If wrong, read the rationale. Move on to the next question.
And that's glorified memorization. You're not building reasoning skills. You're just adding more patterns to your mental database. When I see X scenario, pick Y answer. But the NCLEX doesn't test pattern recognition. It tests clinical judgment. So here's how you should actually use practice questions. Before you look at the answer choices, ask yourself, what is actually happening to this patient? What system is involved? What's the priority concern? What could kill them if I don't intervene? Then look at the answers and ask, which of these addresses the priority? Which of these treats the cause versus the symptom? Which of these prevents the most dangerous outcome?
So you're using the question to practice reasoning, not just to check if you memorize the right answer. You're training your brain to think like a provider, not like a test taker.
Exactly. And here's what most students don't realize. When you get a question wrong, the rationale is the least important part.
Wait, really? I thought reading the rationale was the whole point.
The rationale tells you why the correct answer is correct, but it doesn't tell you why you got it wrong. And if you don't know why you got it wrong, you're going to make the same mistake again. So here's what I tell my students to do. When you get a question wrong, before you read the rationale, ask yourself, what was I thinking when I picked that answer? What did I miss in the question? What assumption did I make? What pattern was I trying to match?
You're diagnosing your own thinking errors. That's metacognition, thinking about how you think. And that's what separates students who pass on the first try from students who keep failing, despite doing thousands of practice questions.
Exactly, because if you don't fix the thinking error, you'll just keep making it. The real reason you freeze under pressure. Now let's talk about what happens in high-pressure situations. Exams, clinical rotations, codes, emergencies. Your brain goes into stress mode, and suddenly you can't think.
This is what students describe as, I know this, but I can't remember it right now. The information is in there somewhere, but they can't access it when they need it.
And here's why. When you're stressed, your brain prioritizes survival over thinking. Your amygdala takes over. Your prefrontal cortex, the part that does logical reasoning, goes offline. You lose access to your working memory. You lose access to your long-term memory. You're running on pure instinct. And if your instinct is panic and try to remember what I memorized, you're going to freeze.
So the students who rely on memorization are the ones most likely to freeze under pressure, because memorization requires calm, focused retrieval, which is exactly what you don't have in a high-stress moment.
Exactly. But if you've built mental models, if you understand how systems work, if you've practiced reasoning through scenarios, that doesn't disappear under pressure. Because reasoning is a skill, and skills are stored differently in your brain than facts. Let me give you an example from my own experience. When I was working in the ICU, we had a patient code: full arrest, chaos, adrenaline. And I didn't freeze. I didn't panic. I didn't try to remember what to do. I just did it.
Because you had practiced the skill so many times that it became automatic. You weren't thinking, what's the ACLS algorithm? You were just running the code.
Exactly. That's the difference between knowledge and skill. Knowledge is fragile under pressure. It disappears when you're stressed. Skills are robust. They stay with you even when your brain is in fight or flight mode. And clinical reasoning is a skill.
Which means it has to be practiced like a skill, not memorized like a fact.
Exactly. You don't learn to play piano by reading about music theory. You learn by practicing the piano. You don't learn to drive by memorizing the rules of the road. You learn by driving. And you don't learn clinical reasoning by memorizing facts. You learn by reasoning through cases. How to build reasoning skills, not just knowledge. So how do you actually build this skill? Here's the framework. Step 1. Learn the mechanism, not the list. When you're studying a disease, don't just memorize signs and symptoms. Ask, why does this disease cause these symptoms? For example, diabetic ketoacidosis. Don't memorize. Symptoms are polyuria, polydipsia, polyphagia, fruity breath, small respirations. Understand. The body can't use glucose, so it breaks down fat for energy. That produces ketones. Ketones make the blood acidic. The body tries to blow off CO2 to compensate. Small respirations. Glucose spills into the urine, pulling water with it. Polyuria. The patient gets dehydrated and thirsty. Polydipsia. They're starving at a cellular level despite high blood sugar. Polyphagia.
So now, instead of memorizing 6 separate facts, you understand one process. And from that process, you can derive all the symptoms, predict the complications, and understand why the treatments work.
Exactly. Step 2, practice reasoning out loud. Don't just read about cases, talk through them. When you see a clinical scenario, narrate your thinking. Okay, this patient is short of breath. What systems cause shortness of breath? Respiratory, cardiac, anemia, anxiety, metabolic acidosis. They have crackles and edema. That's fluid overload. So this is probably cardiac, specifically heart failure. What's the priority? Get the fluid off before they go into respiratory failure. What would I expect to see if they're getting worse? Worsening oxygen saturation, increased work of breathing, altered mental status.
You're making your thinking visible, and when you make it visible, you can catch errors in your logic before they become errors in your patient care.
Exactly. Step 3. Focus on why, not what. Every time you study, ask why. Why does hyperkalemia cause peaked T waves? Because potassium affects cardiac repolarization. Why do we give calcium gluconate first? Because it stabilizes the cardiac membrane without lowering potassium. Why don't we just give kayexalate? Because it takes hours to work, and the heart could arrest in minutes.
When you understand the why, the what becomes obvious. You don't have to memorize treatment protocols because you understand the logic behind them.
Exactly. Step 4. Test yourself on application, not recall. Don't quiz yourself with what are the signs of heart failure. Quiz yourself with, if a patient with heart failure is getting worse, what would I see first? Don't ask, what medications treat hyperkalemia? Ask, a patient has a potassium of 6.8 and peaked T waves. What's my priority and why?
You're training your brain to do what it needs to do in real situations. Apply knowledge under pressure, not recall it under ideal conditions.
Exactly, because recall is tested in nursing school, application is tested on the NCLEX, and in real life. Here's what I want you to take away from this episode. You are not failing because you're not smart enough. You are not failing because you're not studying enough. You're failing because you're using the wrong strategy.
Memorization works for nursing school exams that test recall, but it fails spectacularly for the NCLEX, for clinicals, and for real patient care, all of which test reasoning.
And here's the good news. Reasoning is a skill, which means it can be learned, which means you can learn it. But you can't learn it by studying harder. You can't learn it by doing more practice questions the same way you've always done them. You have to change how you study. Stop memorizing lists, start building mental models, stop trying to recall facts, start practicing reasoning, and stop reading rationales passively. Start diagnosing your thinking errors.
And most importantly, understand that your brain has limited working memory, especially under stress. So the goal isn't to cram more information in, it's to build frameworks that let you think clearly, even when you're under pressure.
Because that's what providers do. We don't memorize every possible scenario. We understand how systems work, and we apply that understanding to whatever walks through the door. And that's exactly why I created Think Like a Nurse and Think Like a Provider. These are clinical reasoning systems designed specifically to help LPN, RN, and NP students develop the necessary skills to excel in clinicals and at the bedside. Not more content to memorize, not more facts to cram. Actual frameworks for building mental models, actual practice in reasoning through cases, actual skills that work under pressure. You can find the link in the show notes. And if you're looking for community, a place where you can practice this kind of thinking with other nursing students who are serious about becoming excellent clinicians, be on the lookout for the Think Like a Provider School community. It is going to be a community designed to change the way you think, understand, and do nursing. We will work through real cases together. We practice clinical reasoning. We build the skills that actually matter. The link to join the waitlist is in the show notes as well.
Everything you need to stop memorizing and start reasoning is right there.
But for now, I want you to try this. The next time you're studying, stop after you read about a disease or condition. Close the book and explain out loud how it works. Not what the symptoms are, how the mechanism causes those symptoms. If you can explain the why, you understand it. If you can't, you're just memorizing.
Because understanding is what gets you through exams, through clinicals, and through your career. Memorization just gets you through the next test, if you're lucky.
Thanks for listening. I'll see you next week.
See you next week.